Hello.
Hello?
We're gonna start with the webinar. I wanted to say good morning, everyone, and thank you for participating in the New Jersey Statewide Network on Cultural Competence webinar. The NJNCC includes a network of over 130 organizations and agencies, and its mission is to facilitate access to equitable and quality services for individuals, families, and communities through culturally and linguistically appropriate service delivery. One of our activities is to offer webinars on a variety of topics in the fall and in the spring. Today's webinar title is Cultural Implications of Screening for Families from Diverse Backgrounds. This presentation will share information about the cultural implications of screening for families from diverse backgrounds, as well as lessons learned from projects funded by the CDC, the U.S. Centers for Disease Control and Prevention, and the New Jersey Governor's Council for Medical Research and Treatment of Autism. My name is Nancy Scotto-Rosato, and I'm a research scientist and one of the coordinators of the Autism Registry at the Department of Health. I will be moderating for this webinar. Before I begin, I would like to address a few housekeeping items. Because of the number of participants, your telephone lines will be muted throughout the webinar. However, using the webinar technology, you can submit questions at any point during the presentations via the chat or questions box on your webinar console, typically on your right-hand side. You can send questions at any time during the presentation. Diana will compile your questions and will address them at the end of the session. Please note that we may not be able to pose every question to the presenter and may combine some questions. Additionally, this webinar will be recorded and archived on the NJNCC website. Finally, a short survey will pop up on your screen immediately following the webinar. Your feedback is important to us, and we appreciate you taking the time to fill it out. Now I'm going to hand over the presentation to Diana.
Thank you, Nancy. I'm just going to introduce ourselves. I'm Diana Otan. I'm the co-director at the Statewide Parent Advocacy Network.
I'm Jeanette Mejia, and I am the Family Resource Specialist for Middlesex County and the Quick Peak Coordinator for the Developmental Screening.
Good morning. This is Deepa Srinivasavardhan. I'm CDC's Learn the Science Actually Ambassador to New Jersey and also Family Resource Specialist at the Center for Neurological and Neurodevelopmental Health.
So I'm going to start by just talking about what we see as the impact of culture and race and language. We know that children from racially and ethnically diverse backgrounds are less likely to be screened early, to have follow-up evaluations when they fail a screen. They're less likely to get an early diagnosis, and they're less likely to access early services. We also know that there's significant racial and ethnic disparities in the median age of first evaluation for autism spectrum disorders, where we have whites have a median age of 38 months, African Americans 40 months, and Latinos 43 months. And we also know when we look at prevalence, there's a difference. Non-Hispanic white children were 30% more likely to be identified with autism spectrum disorders, or ASD, than non-Hispanic black children, and 50% more likely to be identified than Hispanic children. And so, given what we know about the importance of early identification and early connection to services, and also accurate identification, we know that this is a major problem. We have some significantly poorer outcomes for children who are African American or Latino. And that's important enough that we need to make sure that we are providing the supports that are necessary to make sure that diverse families are connected to appropriate screening, evaluations, diagnosis, and services as early as possible. What are some of the issues that we face? One of the things is screening is culturally sensitive. There's a significant influence of cultural expectations, which play an important role in child's development. You know, at what age do people expect that children will be able to hold utensils or sleep by themselves? When do families expect their children to speak independently? What's the expectation around eye contact or pointing? what's the expectation around the extent to which young children try to get adult attention. All of these types of behaviors that are used in screening and in identification are types of activities of children that really are impacted by cultural experience and expectations. Parent perspective on screening is impacted also because often African American, Latino, and other immigrant families are not as aware of healthy developmental milestones as more middle class and Caucasian families, and often are unsure about what questions they should be asking. And particularly when you're talking about immigrant children, often from where their families come from countries of origin where universal health care is not easily accessible, many may be unclear about the importance of early screening and screening tools, how preventative care is critical, and how to access primary care or a medical home. We also know that both from research and from our own experiences as a family organization that works with many immigrant families and families of color, that many immigrant families and families of color are raised with cultural beliefs that see disability and special health care needs in ways that don't support early screening or follow-up evaluation when the potential needs are identified by screening. Sometimes this may be because there is significant stigma in their respective communities around having a child with a disability or diagnosis. And then the screening tools themselves often don't take into account cultural and language implications. Many screening tools are not translated into the multitude of languages that are needed internationally, but also in our own country and in New Jersey, where we have so many diverse cultures and languages. And translation alone is not enough because translation of word by word does not translate the cultural implications of the kinds of questions that are used by screening tools. We also know that pediatricians themselves report difficulty in identifying signs of autism spectrum disorder in children whose families were Latino or African American or whose language was Spanish or other non-English languages. And so pediatricians are telling us that they don't feel as comfortable in being able to identify the signs and symptoms of autism spectrum disorder or even really effectively communicate with parents about screening, what screening does, the importance of screening, and how to follow up if screening identifies potential problems. So a couple of barriers to accessing services for immigrant families in New Jersey that also contribute to this problem around early screening, early evaluation, early diagnosis, and early access to services is that some of them are in kind of expectations that immigrant families have, and some of them are systemic barriers. So immigrant families are less likely to have expectations of good health care for their children, especially children with special health care needs because of lack of access to health care in their country of origin. And, you know, honestly, in some countries, because of cultural beliefs around children that have significant disabilities. Often immigrant families are unclear about their coverage options and information about services that might be covered by health insurance. They may be scared or hesitant to talk to their child's provider for a variety of reasons, including fear around immigration status. They're often unaware of existing healthcare services and healthcare financing options and how to access them. We're in a state right now in our country where there's significant anti-immigrant rhetoric, which is heard every day, everywhere, in every state and in every community. And if it's not heard on the street, it's definitely heard on the television. And many immigrant families are intimidated about trying to find services or to even find out whether something is a concern for their child because of that anti-immigrant rhetoric. And often mixed immigrant families are unaware of their eligibility status, and so they may feel that because there's one member of their family who is not eligible for health coverage or to access public health services, that no one in their family is able to access those services, even if their child, for example, may have been born in the United States and therefore be a citizen. There are other barriers. So there are significant limits on language access for families with limited English proficiency, despite the fact that there are very strong federal and state requirements to provide language access, and some of the strongest requirements are in the health field. So health providers, because the implications of not understanding health instructions or health information are so significant, the U.S. Department of Health and Human Services has very strong requirements around providing language access for health issues. Of course, the fact that there are limits on immigrant parent eligibility for health coverage and other services impacts coverage and access to services for eligible children. And we know that, for example, when the when the parent can't access public health insurance, they're less likely to try and get public health insurance for their children. Lack of cultural diversity among providers also impacts immigrant interest in reaching out for help or accessing services. Families from diverse cultural and racial backgrounds really are looking for people who understand and are empathetic to their experiences and who they believe will be able to give them better information about what they should do than another provider. Immigrant families in general, whether they are documented or undocumented, are frequently less likely to be aware of resources to help their children or to reach out to access them. And there's often among immigrant families a fear of government authority. Sometimes that's based on their countries of origin, where they may have fled their country of origin because of concerns around retaliation or violence, or sometimes that fear is based on their own experiences of discrimination in the United States, particularly when families have one or more members without documentation. We know that immigrant children in the United States are more likely to be poor, to have health and development challenges, to live in environments that exacerbate existing disabilities and special health care needs, and thus to need services like early intervention and preschool special education that earlier screening and earlier evaluation and earlier diagnosis could help them access. And so we need to be cognizant of these barriers, both the barriers from the immigrant families themselves and the barriers in our systems, in order to improve access and improve outcomes. The basis of our work at SPAN, and this is across all of the different work that we do, is a belief, a very strong belief, that families are the ones that have the greatest interest in making sure that their children's and family services meet their needs. And so as families, we have the most to gain in improving services and outcomes. We believe that parents at all levels can be very powerful partners with national, state, and local agencies across systems. That it's critical to provide health messages to diverse families in ways that they understand and accept, and that it's important both to provide direct information and support to families, but also to prepare professionals to be able to communicate more effectively with diverse families. So our approach is strengths-based, family-centered, and solutions-focused. Our goal is to enhance the leadership and advocacy skills of every parent within their family, within their community, and in systems change. And our motto is empowered parents, educated, engaged, effective. And we believe that it is through that advocacy that families can become effective partners and agents for change at all levels. So all of the areas of our work, we provide leadership development for parents through peer-to-peer education support and empowerment. We believe that parents can be leaders regardless of their education, literacy level, or current situation. We try to build leadership and not dependence. And we measure our effectiveness in enhancing family confidence, competence, attitudes, and skills in multiple ways. Focus groups, pre-post surveys, telephone callbacks. And really believing that with the right information and the right support from people who really understand where parents are coming from, that parents will be able to make the changes in their own behavior and also access the services that they and their children need. So one of the things that we think is really important, both in terms of what we try to do, but also in terms of what provider agencies should be doing, is really routinely asking, listening to, and incorporating the voices of diverse families in programs, services, and policies. So being ready to hear what families say, being ready to follow where families lead, providing the supports that families say they need, and really following through with the concept, nothing about me without me. Starting with understanding with diverse parents who have been there, starting where parents are, and providing multiple pathways to leadership. And one of the reasons this is so important is that we know from the research that what works well for one group of families in terms of communicating expectations and communicating what children's available services are and how to access them may not work for another group of families. You can't lump all immigrant families together. You can't lump all African American families together. You really have to be willing to hear what families tell you about what are effective strategies and ways to move forward. You can't just buy something off the shelf. So it's very important to target services so that we are providing families from underserved communities more intensive supports that are flexible and responsive to their specific needs. So when pediatricians are talking with parents, they need to have a whole toolkit of messages and communication styles and strategies to be able to convey the importance of screening and what to do after screening and where to go to get services and supports and resources so that families feel confident and competent in being able to follow through. Trust is critical, building trust is critical, and some of the research shows us that there are so many different cultural and racial and socioeconomic implications of trust where families from underserved communities may have had very negative experiences with providers from certain agencies or systems or of different racial cultural backgrounds that trust is already destroyed even before the family comes to you to try to get support or services. It's really important to recognize that families do have strengths and to help them recognize their strengths and help them believe that they can get where they want to go. And to do that, we really have to see that potential in every parent and really make space for new leaders in all of the work that we're doing. So how do we try to help overcome the barriers in getting access to early screening and then following through with screening and getting connected to services for immigrant and African American and other underserved families? Well, one of the things that we do across all of our programs is try to enhance awareness among those families of the importance of healthy developmental milestones in infants and young children. So promoting Act Early materials is one example. Enhancing the understanding that early and periodic screening is critical and that families play an important role in making sure that their children are screened. Enhancing that early access to early intervention, health insurance, and healthcare financing options and services for parents and children. We have a multitude of fact sheets in 9 languages available in hard copy on our website, but also having staff and SPAN resource parents and partner agencies that are providing this information to families on a one-on-one basis. Helping families access quality health care providers, both for insured and uninsured families. So partnering with the federally qualified health centers, making sure that the federally qualified health centers are understanding more about children with special health care needs, because FQHCs serve a lot more adults than children, and their focus is generally on well care and preventive care. So really helping them understand their critical role in working with families around early screening and connection to services for children who are identified as having special needs. And then increasing health literacy so parents understand their coverage, their insurance plan options, and covered services. Our goals in this area are to help diverse parents understand the importance of screening and follow through to diagnosis, doing that through that direct outreach and assistance, connecting parents from diverse backgrounds with other parents with similar backgrounds and who speak the same language, collaborating with community-based organizations and immigrant organizations and cultural brokers, and providing professional development for child serving agencies. And in just a minute, we're going to start talking about some of those specific activities. And then once families do have a child who has been identified as having a special need, connecting those families to culturally and linguistically appropriate services, including medical homes, and building the capacity of families to advocate at the individual program and system level to improve those services and systems so that it's easier to access for the next family. I'm just going to let you know we're going to talk about 4 different activities that have been funded by the Centers for Disease Control, by the U.S. Department of Health and Human Services, by AMCHIP, and by New Jersey Department of Health. Our Learn the Signs Act Early Ambassador Program, the collaboration with Children's Specialized Hospital in Quick Peak community screenings, parent-led screening trainings to FQHCs and Head Start and other early childhood programs, the Act Early State Systems Implementation Grants, which is a partnership with the Boggs Center, and then the Autism Medical Home pilots. And now I'm going to turn it over to Deepa.
Hello, everyone. I would like to give a quick overview about the Learn the Signs Act Early program, as well as my role as the ambassador to New Jersey for that program. The Learn the Signs Act Early program is funded by the U.S. Centers for Disease Control and Prevention, and it's done in collaboration with the Health Resources and Services Administration, Association of University Centers on Disabilities, AUCD, and Association of Maternal Child Health Programs, AMCHIP, and other partners. The goal of this program is to enhance the collaborative efforts to improve screening and referral to early intervention services across the country. It also supports the work of ambassadors like me to promote awareness of the importance of and improve early identification efforts in their state. So as part of my work, I share the Learn the Signs Act Early program information and resources with parents of young children and other professionals by collaborating with other projects within SPAN, as well as programs and organizations across the state that serve families with young children. Learn the Signs Act Early resources are great and easy to understand, and most of them are available in Spanish, and some of the resources have also been translated into a few other languages, such as Arabic, Korean, Portuguese, Somali, Nepalese, etc. And all these resources can be found on the CDC website and the at cdc.gov/actearly. What we have done here in New Jersey is we customize the milestones brochures. Next slide, please. And these brochures, we collaborated with the New Jersey Department of Children and Family, the Office of Early Childhood Programs, and where we have the Help Me Grow project launch and the New Jersey's Early Childhood Comprehensive Systems Programs House, and we customized it so the families and organizations serving those families with young children have the information they need when developmental concerns are noted. So they can get connected to early intervention if the child is between the ages of 0 and 3, or Project Child Find if the children are between the ages of 3 to 21. And they also have access to the SPAN contact information. We're also in the process of including the central phone line for the Help Me Grow system for New Jersey, which is the 211 number in case families need to get connected for early childhood services.
Deepa, I just want to add that one of the reasons why this customization is so important is that there's a lot of research that shows that, particularly for underserved families, the more contacts they have to make in order to find what they need, the less likely they are to follow through. So the CDC has their Track Your Child's Developmental Milestones, and without this customization, families would be connected to the Learn the Signs Act Early, which then would connect them back to the resources in New Jersey, to the early intervention system, et cetera, which would mean fewer families would actually follow through to the end to actually reach out to these supports and services within our state. By having this customization to have the information right on the brochure itself, families don't have to go to the CDC to get referred back to New Jersey. The information is right there, and they can get it just with one call or outreach.
Thanks, Diana. And I would also like to add that it saves a lot of time for the families to go through the process of getting connected to CDC and then getting referred back. So similarly, there is another resource called the Milestone Moments booklet, which most of you may be aware of, and they provide detailed developmental milestone checklists for children birth to age 5. So we are in the process of customizing those as well for New Jersey, and it would also include a developmental milestones tracker and a screening tracker, as well as a well-child visit tracker, so parents can monitor and document their child's development in one booklet, and it would also be easy for them to share it with their pediatrician or other professionals who they're working with. Now I would like to turn it over to Jeanette Mejias.
And before Jeanette speaks, I just want to, make sure that you can see that, in addition to the language, there's also been, changing the picture on the brochure that's in Spanish to reflect a Latino child. So, not just having the words change, but also having the pictures change so that families feel that this brochure speaks to them.
Right. Yeah, so they can, all the materials can be customized and translated according to the needs of the different organizations and the needs of the families. Jeanette?
Yes, good morning. Our quick peek screenings are developmental screenings provided by experts from Children's Specialized Hospital at community locations for diverse families of young children from underserved communities. We typically perform these developmental screenings in libraries, early childhood centers, family success centers, and we've even done the screenings at the Kohl's department store because they are one of our funding sources for the screening. And why we pick these particular locations, because we are in these urban areas, we find that a lot of the barriers that our families have is transportation. So we want to ensure that these screenings are accessible to them. The screenings are 30-minute, which includes interactive questionnaire for parents and children. So what that means is the parent is in the screen, is part of the screening process with the evaluator. Each family will receive personal feedback, recommendations, and educational materials. The screenings are offered in English and in Spanish. And also at the screenings, we have a SPAN family resource specialist available at the site to provide that parent-to-parent support. In addition, the family resource specialist will provide technical assistance to ensure that parents follow through with recommendations and to share the resources, including the ACT Early materials that Diana and Deepa touched upon in the previous slide. Now, just to expand a little bit upon the role of the SPAN family resource specialist, typically it's a bilingual family resource specialist, just to make sure that if we have any families, that there is no language barriers, and that the family feels that they're identifying with that parent. Typically, that family resource specialist is a parent of a child who did not meet those particular milestones, and that's really important because that parent feels that connection. So typically, when a child does not pass developmental screening, the evaluator will walk the parent over and introduce the family resource specialist. If the child is at the age under 3, then the family resource specialist will make the referral to early intervention services while the parent is there. Early intervention services will call within the hour and get all the information and then they will contact the parent within 48 hours. Now, if the child is 3 and older, because the screenings are for children from ages 1 to 5, but if the child, say, is 3 or 4 years of age, then the family resource specialist will provide, at the time of the screening, a letter, which is a template letter in either English or in Spanish, to ask the child study team in their district to provide a full comprehensive evaluation to see if the child qualifies for any related services through the school. And the family resource specialist will follow up with that parent just to ensure that everything is going, smoothly for them. Now, we've had instances where families had to be in the waiting game with getting a neurologist appointment, but we ensure that those families are connected to vital community resources and also just link them to the right services while they're in the waiting pattern. And evidence shows that families provided with support are likely to follow through, and it really increases the confidence and their sense of competence. Next slide.
Yeah, and I just want to say add one thing to what Jeanette said, which is, again, when you look at the research shows that families who are just given a phone number to call, in other words, they're just given a referral by the family having to follow through with a phone number, that families are less likely to follow through with that than if they actually have support in making that first outreach. And that's particularly true for families from diverse cultural, racial, and language backgrounds. And particularly if that family makes that first call and isn't immediately connected to someone, then those families are even less likely to follow up after that unsuccessful attempt to make an appointment for an evaluation, et cetera. So that's one of the reasons why having that family resource specialist from that diverse background there to make that connection with the family and to actually give them kind of a warm connection to the place where they can get additional evaluation and resources, and then follow up to make sure that process has been successful and the family's not experiencing barriers.
And that's an excellent point, Diane. I appreciate you chiming in on that, because we often find that parents do get a sense they're paralyzed. They really have fears of taking that next step. So having that parent comfort them and ensuring them that, also just letting them know by them being proactive and getting that phone call in will really ensure the success of the child as they start to transition into early childhood and the preschool center. And mostly our families really, any parent wants to see the success of the child. So thank you for adding that in. And this slide here shows our fabulous team at work. And you see in the middle of the slide, we're at a Kohl's department store. And we do have a parent who is pictured on the bottom alongside with me on the right, who went through our SPAN resource parent training, and she's also provided those supports at those developmental screenings, which has been really vital, having those families get that connection from a parent. And I also like to add, I am a parent of 2 children with special health care needs, so I definitely understand, everything across the board with the raw emotions that those families are feeling at that time. And that's really something that is unique to what we do here in New Jersey. Next slide. And at this time, I'm going to go ahead and let Deepa take over this portion of the webinar. Deepa?
Thanks, Jeanette. So the New Jersey's Act Early State Systems Implementation Grants are initiatives to increase awareness of importance of developmental screening using validated tools. And it is a partnership. It was a partnership between the Bach Center on Developmental Disabilities and the Statewide Parent Advocacy Network. We had 2 grants, one from 2012 to 2013, when we provided parent-led trainings to federally qualified health centers about importance of developmental screening and how to talk to families, etc. And we had 15 in-person trainings and 1 webinar. And during the process of those trainings, we also identified the need to have resources in easily accessible format for these federally qualified health centers. So we developed flowcharts both statewide and per county. And then we had the parent-led screening trainings between 2014 and 2016, and this time for the early Head Start programs about developmental screening. We had 12 in-person trainings and 2 webinars, and the 2 webinars that we recorded recently are one was about resources for connecting families when developmental concerns are identified, and the other one was how to include children with challenging behaviors in the preschool classroom. Both these webinars are also archived on the Boggs Center website, and the flowcharts, again, that we developed for the Head Start programs, which also includes the resources, the community resources and other connections that the families need when developmental concerns are identified, are also archived on the Boggs Center website, which you will have the information later in the webinar for the website. Through these grants, we provided the parent-led trainings. In that, we mean that parents led the trainings and shared their journeys for their children's diagnosis, to receive their children's diagnosis. We featured Learn the Signs Act early materials as well as other statewide and local resources that I just mentioned we were able to develop. Next slide, please. So as I said again, this was funded by the CDC and MCHIP and was a partnership between SPAN and the Boggs Center. We disseminated Learn the Signs Act early materials to emphasize the importance of developmental monitoring and screening through family stories and other resources. In addition, we also provided tips for talking with families from diverse communities and connecting them to resources when developmental concerns are identified.
And again, this is so important because how you talk to a family when a developmental concern is identified is so culturally and racially impacted. If you're talking about families from India, families from Guatemala, families from an urban African-American community, families from a Mexican migrant community in South Jersey, all of these families will respond differently to the identification of a possible developmental delay through screening because of their own cultural experience and often other things like religious beliefs, etc. And so one of the most important things that has to happen is that the people who are really facilitating the screens really have to understand how to talk with a family from a diverse background in a way that's going to encourage that family to actually follow through with evaluation and then with accessing services. You can't talk to families the same way. You can't say the same thing to every family because they will respond differently. And the goal is not to do the same thing, but to get the same outcome, which is to actually get the child to the place where they can get the identification and then access the services.
Thanks, Diana. And I know Jeanette will be sharing later about how the parents shared their stories and how that was helpful for the federally qualified health center staff and the Head Start program staff to understand the needs of the families from diverse cultures. So our approach, we use the Plan, Do, Study, Act cycle. So planning leads to action, action generates experience, experience provokes thinking, from thinking to planning. So we followed this cycle throughout the implementation of the project. So to begin with, we surveyed the early Head Start and Head Start programs for their needs related to training and their needs related to the awareness of about resources that they would like to share with their families. Then we plan to schedule the trainings at convenient locations and times. Usually the trainings were scheduled around the lunch hour when the staff were able to do a lunch and learn, which worked out best for most of these centers. And then we discussed the training, curriculum, and resources to be shared through our early screening work group at the Community of Care Consortium. The Community of Care Consortium is a quarterly meeting of the stakeholders and programs across the state that meet to talk about the 6 core, about all the activities and work that's happening around the state, around the 6 core outcomes for children and youth with special healthcare needs. And one of the work groups is around early screening, and we discuss the training curriculum as well as the resources that these programs need, and we created the resources as well through the work of this work group. I would also like to add that Head Start representatives are part of our Community of Care Consortium, and they volunteered to pilot the training. Then we conducted the pilot trainings, received feedback, and revised our training curriculum based on their feedback. So that's what I meant by the Plan, Do, Study, Act cycle. Now I would like to turn it over to Jeanette, who would be sharing a little bit about what happens during those trainings and more in detail about the resources that we develop.
Thanks, Deepa. So in the action, we conducted trainings, as Deepa have already mentioned, at the convenient location. So an example would be, we go to the Head Start and we are very flexible, meaning we may go at their lunch hour, and if there's a big staff, we might do from 12 to 1 o'clock and 1 to 2, maybe do 2 sessions. We usually cater them lunch, just so it could be just very informal, but we find it that that really works well, and they're very receptive to that type of training. We compiled and shared resources based on the needs expressed in the survey, and I'm going to be going over in more in detail of what we created in terms of the resources. We created statewide and county-specific flow charts of steps to be followed and resources that family needs to be connected to when a child screens for positive and developmental concerns. We also provide at these trainings personalized tracking milestone brochures with New Jersey-specific resources, which is in partnership with the New Jersey DCF Office of Early Childhood Programs, and evaluated the programs upon completion of training. So next slide, please. So sharing parent stories. This is just framework. So what we do is when we go to these Head Start and give these trainings, these parent-led trainings, we have 2 parent stories that are going to be shared with them. And this is just a framework of what the parent's going to be sharing. We do 2 stories because, as we all know, 2 parents experience very different things with their children and through their journey. So we make the introduction, the parent will share what their concerns were at the time, whatever age that was for their child, and what process did they go through in the screening and the evaluation. What were the screening results like? Were they positive? Were they negative? Were they ever even screened? And were referrals to services and supports offered? Most likely you'll hear that often not. They will share what they're glad that their doctor did, and they also will share what they wish their doctor would have done. And the reason why we feel that these parent stories are very important for these educators to hear is because whatever that parent is sharing, the likelihood of them having a child in their classroom, they can identify or resonate with them. Maybe certain things that parent is sharing that the child was struggling with could be the very thing that that educator is witnessing, which we also give them tools and train them how to do developmental monitoring. Anyone can do that, especially if you're very involved with young children. If you're in early childhood center, even even that much more, you should be doing developmental monitoring, but we give them tools to do that. Next slide, please. So reflection and learning. So, you know, before I get into this, I do want to say that when these parent stories are shared, we see the facial expressions of these educators really is telling. They really don't have the tools. They don't understand how to communicate certain things to families when they do witness that the child is showing some developmental delays. So that parent-led screening really gives them specific verbiage that's from the CDC, what to say that is in a way that is not going to have the parent get upset. As Diana had mentioned previously, you do have to have a way how you approach families. This is not a one-size-fits-all in terms of how you're going to convey the information. So this training was very invaluable to them. We provide a binder for them, a training binder, where they can refer to it. They can actually take out some of the handouts that are in there, make a copy, hand it to the parent, encourage them to have that conversation. A conversation would be, has Johnny, you know, Johnny's been demonstrating certain behaviors here in the classroom. Have you noticed he does that at home as well? And really helping these educators understand that they need to partner with these families and really start gaining that relationship with them, because you have to foster relationships before you have those type of conversations. And always leading back to those developmental milestone booklets, which is really a guide to assist them, because it's not what they feel. It's not that they think this child has something going on. It's based on actual facts, and that's what the training, the content of the training is. So reflection and learning. Our evaluation demonstrated satisfaction with the knowledge gained from the training, as well as usefulness and relevance of training and resources to their work. They were head over the moon. Most of our educators, when we did these trainings, they didn't even know this stuff existed. Increased knowledge of Learn the Signs and Act Early resources after the training. It went from a 2.76 to a 3.48 on scale of 1 to 4, which is really significant. It also shows an increased comfort in communicating concerns about developmental delays with parents before and after the training. 2.79 to 3.46 on a scale of 1 to 4. And it increased the intent to share resources with families. These educators were gung-ho, like, wow, this is like excellent. Now I have something to go by, because I always had these reservations, but didn't know how to go about it. So this was just invaluable. And it was just really a joy to be able to provide that to the educators. Yes, Diana.
I just want to say this is consistent with the findings in the training to the federally qualified health center staff as well. It's, you know, having, feeling more comfortable, having the professionals feel more comfortable in communicating concerns about developmental delays to parents from diverse backgrounds is really the first step in actually having them communicate those concerns, because so many of the FQHC staff and the Head Start staff, expressed to us that they didn't have the words, they didn't know how to talk about it. And in the stories, when for example, when Jeanette tells her story about her one child who didn't have early screening and then her second child who did, and the difference in that, that is such a powerful thing, because then it emotionally connects the professionals with an understanding about it's critical for this family's future that you do raise these concerns with families, even if you're hesitant to do so, because it can make such a big difference in the trajectory of the child's life. I mean, it's all about the lifespan and making sure that we get access early. And so getting that emotional connection to family stories about how important that early screening is and how important it is for them to share this information with families, and giving them some tools to do that is really critical in increasing that early identification.
Absolutely. Thank you, Diana, for that input. Now, as you can see here, we have a state flow chart for healthcare providers, and this is what we've created when a child screens positive for developmental concerns in New Jersey, particularly with autism. And this flow chart was really developed as part of the New Jersey First Act Early State System Grant, which provided in-person, as I just discussed and shared, the parent-led training. And also we provided the training to the health care staff as well, and at several of New Jersey's federally qualified health centers. So this is just really a wonderful tool and a resource to really just assist the families to get to, or assist them to be able to give them the referrals that they require. Next
and I just wanted to say that we created this for the FQHCs, and yet it's become one of our most popular resources to share with families themselves, and not just the statewide one, but the county-specific ones that will tell you who in your county, who's the Special Child Health Services Case Management Unit in your county, where can you get a county-based resource, and so it's really very tailored to that county. But families, this is very useful to families as well, and many of the FQHCs, actually hand this out to families in addition to sharing it with their own staff.
Yes, absolutely. And as you can see here, we developed a county-specific flow charts for the early child care staff, and it's very colorful, which I kind of love that it is, because it's very appealing to our families. And I think it's just been wonderfully done. The next steps. You can see there's a school there in the background, and when you have developmental concerns, when they're identified, where do they go? And so the list, it gives you several important connections that providers should help families make upon recognizing those developmental concerns. Now, if we're not showing it here, but I believe if you flip in the back of that flow chart, for each color, it'll explain the role of those agencies.
There it is.
And also that.
This is the back.
Yeah. Oh, okay, great. Yes, this is the back of it. Thank you, Diana. So the flow chart, was developed for each New Jersey 21 counties as part of our New Jersey Second Act Early State System Grant project. So as you can see, this is just really parent-friendly, and there's no guesswork in this. So I think this was just really wonderfully done and developed by the Boggs Center of Developmental Disabilities. So really great work there. Now,
and I would like to add that these are disseminated as magnets as well, in addition to paper copies.
Yes, and we have them in Spanish and in English. And I just want to add, this is the magnet that you're looking at in Spanish. And we actually, at one of our consortia meetings, had our parent leaders, our Hispanic parent leaders, take a look at the language to make sure it was universal and to make sure that it made sense. And now we have parent leaders across the board from Mexican descent, Central America, all across. And it all was, a lot of people tend to think that when you do something in Spanish, it's not that simple. We have many cultures within the Spanish community, and one word might mean one thing in the Mexican population, and it can mean something completely different for that person who's from Costa Rica. So we wanted to really ensure that we have the input of these parents who really, can be able to lend to us what made most sense, and to make sure that we have that universal language. So I'm very, we thank our parent leaders for stepping in into helping us, and that's just some of the things that we do at our stakeholder meetings. But I just want to point out, this is not intended for this to be the list of all the resources available for families. It's just our hope that family navigators and supporters and case managers will suggest to families additional connections or resources that are not included in the chart. However, the chart is a good start, everything that we have here. Next slide. At Autism Medical Home, we have SPAN staffed house part-time at 3 of our centers. We have Hackensack University Medical Center, Children's Specialized Hospital. I actually happen to be the Family Resource Specialist staff in Mountainside, New Jersey. And Deepa is actually the Family Resource Specialist for CNNH. So as you can see, we are a diverse group of family resource specialists, and we are supported through the Autism Medical Home Grant and Children's Specialized Hospital and other funding through CNNH. And our role is to provide on-site support to families regarding the screening, evaluation, and connection to resources. We really provide pretty much parent-to-parent support and help them really build in their own advocacy journey as they advocate for a child with special health care needs, and to really help them advocate across systems, from healthcare to education, and just really being that vital source to those families who oftentimes feel that they don't have anywhere to go. And the beauty about having a family resource specialist in a hospital setting is that you have that care coordination. So you're having the medical practices, the doctors, making that linkage. So here we are, we arrive, and it's really just wonderful to be able to have that in place. We also, the medical home sites are measuring impact via nationally validated family-centered care assessment, which is through National Family Voices. I'm not sure, Diana, if you want to touch a little bit upon that.
Right. So National Family Voices actually did a nationally validated development of a tool. So it's an evidence-based tool to measure the perceptions of families about whether or not they're getting family-centered care. And it includes questions around cultural and linguistic appropriateness of services and access to services, care coordination, all of the things that the Maternal Child Health Bureau has determined are critical for families of children with special health care needs to make sure that those children maximize their healthy development and get the services that they need. So it was just finalized, just last year. And it is available in English and Spanish, and it's a wonderful tool. And so the Hackensack University Medical Center and Children's Specialized Hospital Medical Home grants are actually kind of part of the first users of this nationally validated family-centered care assessment, which is available free to anybody who wants to use it. So we're running out of time, so I just want to kind of finalize or finish up. I just want to say, what we have learned across all of these projects that really are targeting diverse families around screening and follow-up. First, we have learned that providers are more motivated to make changes in their practice with families, whether they're an early childhood program or a doctor or a hospital, FQHC, when they are connected emotionally to family stories about how what they do matters. And families are more motivated to change their behavior, that is, to actually follow through after a screen identifies a potential disability or special health care need, to follow through to try to access services if the child is actually evaluated and determined eligible. When they themselves are connected to a parent who understands their culture, speaks their language, and has experienced their challenges. It makes all the difference in the world, because that starts off with a trust that isn't present often with underserved families and healthcare and other providers. Just reminding everyone that cultures have different ways of responding to relationships and parenting and conflict. They have different help-seeking behaviors. And there's a lot of research about this, which we're not really utilizing in our day-to-day work on the ground with diverse families in the area of screening, evaluation, and connection to services. We also know that culture shapes people's perception of their status and the status of others, and their relationships and social behaviors, including with regard to conflict resolution. So in some cultures, the provider may think everything is A-OK and hunky-dory, but really the family is very dissatisfied, but in their culture, kind of keeping the peace is such a powerful cultural way of behaving that they're not sharing with the provider that they have concerns about their child or that they have concerns about the services that they're getting. We know that people communicate and process information very differently, and that culture and race has a big impact on this, and that the point of what we should be doing is not to do unto others as we want them to do to us, but really to do unto others as they want us to do unto them. And the importance of really listening with the heart for the heart and sharing our heart with them, particularly when you're talking about underserved families. And so we try to see ourselves as pebbles in a pond that cause ripples that spread in all directions. We know that we can't meet and serve and support every single parent from diverse racial, ethnic, language, socioeconomic backgrounds in New Jersey. And we know that there are many providers out there who are seeing these families, and so trying to be that pebble in the pond and help support not only the individual families that we do get to help individually, but also to provide that professional development and increase that understanding of the professionals of families from diverse backgrounds by using our own staff and the family leaders that we work with from diverse backgrounds who can help them understand in an emotional way as well as in a way that hopefully will change their practice. So we just want to close with 2 slides that talk about resources. There's a wonderful facilitator guide for an in-depth training around considering culture in autism screening that was developed with funding from the Centers for Disease Control and HRSA and AMCHIP and AUCD by the Massachusetts Learn the Signs Act Early Ambassador, who's also a parent, and that's on our website. There's a Promising Practices for Screening of Autism and Other Developmental Disabilities webinar, and Raising Awareness of Child Development Milestones, Birth Through 5, Watch Me Thrive. And then there's the resources that are on the Bog Center website, including those county-specific flowcharts and magnets for early childhood and for FQHCs. And then the 2 webinars that Deepa referenced earlier, Resources for Connecting Families When Developmental Concerns Are Identified, which talks about all of the kind of resources and screening and connection to resources initiatives, and then including children with challenging behavior in the preschool classroom. And so with that, I just want to thank Deepa and Jeanette, not only for their presentation, but also for the amazing work that they are doing in the field and also at the state and national level to raise awareness of these issues with state and federal agencies and providers. But also I want to thank the New Jersey Statewide Network for Cultural Competence for their support in putting on this webinar, and the New Jersey Department of Health for their support of our work, as well as for their support of culturally and linguistically appropriate services and supports for children with special health care needs and their families, and their support for the New Jersey Statewide Network for Cultural Competence.
Thank you, Diana, Deepa, and Jeanette. I just wanted to let you know there are several questions that individual posted, and I know we're ran out of time.
I can't access them.
If you click on the questions, do you see the questions box?
I see a chat box. I don't see a questions box. Where is the questions box?
Okay. All right. So why don't you want to answer the questions now, or did you?
Yeah. I mean, if there's some, sure.
Okay. There's quite a few of them. So one of them asked, where do we forward people that might need help when they come to a local county one-stop?
They take a look at the FQHC or the early childhood county-specific flowcharts, and that will give you information that any service provider or family serving agency could use to connect families to support.
Okay, and so most of these resources, a lot of the questions were about the brochures and the magnets. Where can they get those? The flow charts. They're all part of the websites that you provided, correct?
Yes, you can find a lot of the resources on the SPAN website, and then you can find the county-specific flowcharts and magnets and these webinars on the Boggs Center websites.
So one person asked, where can we get these screening tools, and where can we get screening tools that are families that do not just speak English or Spanish but other languages?
So go to the CDC Learn the Signs Act Early website, and they have a section on screening tools and tools that are available in other languages. Unfortunately, many screening tools aren't, there are many screening tools that aren't even available in Spanish. And if screening tools are available in other languages, mostly they are available in Spanish. There are some tools now that are being translated into other languages, and that information you could find on the CDC website.
And this is Deepa. I'd like to add that even though the tools may be available in other languages, that the availability of a person who can relate to the family's needs and culture is very important at the time of the screening to elicit appropriate responses.
And given that in New Jersey, 38% of births are to mothers who were born in other countries, which is the second highest in the country after California, and that's many different countries of origin and many different languages, we know that this is really an important and pressing need in our state.
Somebody asked whether or not did you provide trainings to Head Starts, and how many, in which counties?
I don't know the counties off the top of my head, but we provided Head Starts to 12 Head Start agencies, I believe, and then we did 2 webinars that are recorded and that are available to anybody, whether it's a Head Start or other program.
I know in the South we did in Camden and Cumberland counties.
And we also covered Essex County as well, just recently, about a month ago.
And I think somebody wanted to know about the screenings, which counties were involved in the screenings that you provide?
I think she means the quick pick screenings.
Yes, yes, I'm sorry, the quick peek screenings, yes.
They vary. There's some in the South, Trenton, Middlesex County, there's a few of them, Union, up in the north in Essex, but they can go into Children's Specialized website and go under specialty programs, or we can actually provide a direct link to contact Amy Norton, who's the evaluator. But they do have it on their website on the calendar.
Okay, great. And one person asked whether or not you worked with the Division of Vocational Rehabilitation.
Well, we do work with them on transition activities, but we have not worked with them around screening for young children because their focus is older.
Right, more vocational.
Yeah, adults.
Right.
So.
Okay. And actually one last question, which was about providing lunches. How did you were you able to provide lunch? Because a lot of the funding that they have do not allow for food.
That was one of the beauties of the collaborative application that Boggs Center submitted with us, justifying the need to be able to provide either breakfast. I think we did breakfast for the FQHCs because breakfast is early morning is a better time for the doctors, and lunch for the early child care programs and Head Starts. And that was included as part of the funding that we received as part of the two grants.
Okay, great. Thank you so much for your time and for a great presentation. And please, if you could, the remaining attendees at the end of the webinar, you'll see a survey. Please complete it, and it'll be great. And hope to hear you for the next webinar. Okay, thank you.
Thank you.
Thank you.